So thank you everyone so much for joining this morning. Good morning. Welcome to the Cultural Brokers Network of Canada webinar series. The CBNC is a nonprofit organization that supports and promotes the work of cultural brokers working in various sectors across Canada, and it was established in 2023. I will also put I'll just put the website address in the chat as well, so you can check out our website and kind of poke around there. So it's culturalbrokers.ca. I just put it in the chat. My name is Jonathan Wade. I'm the Digital Communications Coordinator for the National Cultural Brokers Project, and I work at Manitoba Possible in Winnipeg. I'll be the host for today's event. So today's session is focused on cultural brokering in healthcare. So staff from Umbrella Multicultural Health Co-op in Vancouver will examine cultural brokering in the healthcare system and use examples of scenarios that they've encountered. Before we introduce today's presenters, I just want to go through a few housekeeping items. We've muted your microphones to allow for better clarity and less feedback. Your microphone will be unmuted for any interactive parts and the question and answer session at the end of the presentation. Please feel free to type questions you have in the chat as the presentation goes. We'll do our best to answer as many of those questions as time permits. So today's presenters are Wazhma Wakil and Xochitl de la Rosa from Umbrella Multicultural Health Co-op in Vancouver. So Wazhma Wakil is an Afghan-Canadian, internationally trained medical doctor. Throughout her career, she has gained extensive experience in cross-cultural communication while working in the settlement sector and healthcare services. Her work is focused on helping newcomer immigrants and refugees integrate into Canadian society and address their unique social determinants of health. As a cross-cultural health broker mentor, Wazhma has provided training on cross-cultural communication and navigation in the healthcare sector. Her work has been instrumental in improving healthcare outcomes for marginalized populations. Currently pursuing a Master of Science degree at SFU, Wazhma is expanding her knowledge and enhancing her skills in the field of health with a particular focus on women's health. Wazhma is also a strong advocate for equitable healthcare, particularly for marginalized populations. And Xochitl de la Rosa is an international medical doctor and acupuncturist who is deeply passionate about holistic care, medical equity, and social justice. As a cross-cultural health worker and working in social determinants of health, she uses her unique experiences to advocate for and support those in vulnerable communities. Having personally navigated the immigrant journey, Xochitl brings empathy, understanding, and compassion to her work, always striving to make healthcare more accessible and inclusive. As a mother, she values the opportunities she has received in her new home in Canada and is committed to making a positive impact in her community. Over to you, Wazhma and Xochitl.
Thank you so much, Jonathan. Good morning, everyone. Thank you for being here this morning and listening to this presentation. So I will be speaking the most for the first 30 minutes. We will have Xochitl as well, sharing her experiences and giving examples of her work, working as a cultural broker in healthcare. The last 20 to 30 minutes will be for questions and answers, as Jonathan mentioned. So I wanted to do the land acknowledgement, first of all. I acknowledge that I'm presenting from the ancestral unceded territories of Coast Salish people, including the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam nations. Our community health center, Umbrella Multicultural Health Co-op, is gracefully located on the unceded central Coast Salish territories, the land of Kikite First Nations. And we are grateful to work, live, and play on this land. I came to this land as an immigrant and found safety here, so I strive to deepen my own understanding of the local Indigenous communities, and I commit to reframing my responsibilities to land and community. So today's agenda, so we are going to talk about very shortly about Umbrella Health Co-op, just for you to know where we are located and what kind of service we provide. We're going to talk about who are the cross-cultural health brokers. We call the cultural brokers as cross-cultural health brokers, and this is just one of the names that is used at Umbrella, but that's the same as cultural broker that's used in national, national project and different provinces. We are going to talk about cross-cultural communication, cultural brokering, and healthcare. So Umbrella Multicultural Health Co-op is a community health center. We provide primary care to immigrants, refugees, and those people who are undocumented. So we are not asking them about their coverage, their insurances. We accept everyone. And that's because we want them to receive equitable healthcare here in Canada. At Umbrella, we have clinical team, which are family doctors, pediatricians, nurses. At the same time, we have other programs that provide not only taking care of the physical health of people, but also taking care of the social determinants of health. So anything that impacts health other than medical reasons. We also have health promotion program, and our health promotion program provides workshops to the broader community. It's not only our patients, but also community members who are attending. And we are conducting workshops and different health topics based on community needs. We also have clinical counseling. We provide clinical counseling as group counseling, as well as one-on-one individual counseling. We also have mobile clinic. So our mobile clinic is providing service to foreign farm workers. Our mobile clinic is actually going to the field and providing service right there to make it more accessible to foreign farm workers. We also have different projects and different programs. For example, there's a specific project called, the program is serving refugees and asylum seekers. So we have support workers who are supporting in different languages, refugees and asylum seekers in New Westminster, BC. So before going to cultural brokering and explaining about what is cultural brokering and healthcare, I wanted to mention about culture and what is culture, what is communication. So culture, as we all know, it's all the ways of life, including arts, beliefs, and institutions of a population that are passed down from generation to generation. Culture has called the way of life for an entire society. As such, it includes codes of manners, dress, language, religion, rituals. And what is communication? So communication is a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. So cross-cultural communication is actually the process of recognizing both differences and similarities among cultural groups in order to effectively engaging within given context. So next slide. Thank you, Jonathan. What is actually cultural awareness? How important it is for healthcare providers to be culturally aware when providing service to immigrants, refugees. There are some effective tools for cross-cultural communication. For example, we have to be aware of let's say it this way, we shouldn't be doing assumptions. We shouldn't be having assumptions about cultures. We shouldn't be drawing conclusions based on our own experiences. For example, if someone is coming from a refugee camp, I may think about maybe this person never had access to education, and maybe they never been to school. But those are my assumptions. Nowadays we have refugees coming from different countries that they had so many opportunities going outside of their countries and getting education. So I can't just assume that if someone is a refugee, he might be poor, or maybe he didn't have access to education. So these are just my assumptions, but it can be completely different. So for the healthcare providers, how to approach patients with open mind to meet the needs of this population. So it's recommended for them to take it slow when talking to an immigrant or refugee patient, using appropriate vocabulary. And it's always good, not only for healthcare providers, but also for other service providers, to use simple language, to direct instructions and explanation. Try to avoid complex multi-part sentences, so to make it easy for people to communicate. And that for sure builds trust. Um, Patients will follow up on recommendations. They will have better medical compliances and better health outcomes. Next one, please. Okay, so who are the cultural health brokers? We call them shortly CCHBs, so cross-cultural health brokers. They offer a holistic and family-oriented practice in accessing healthcare. They provide information and support to healthcare providers by identifying the cultural and social circumstances which has impact on care. So saying it simple, they identify the needs, the healthcare needs that patients have. By identifying, they are informing healthcare providers about those needs. At the same time, cross-cultural health brokers doing advocacy for these patients. For example, if a patient receives a large bill from a hospital, and they don't know how to navigate the system, how to negotiate this with the healthcare providers. So the cross-cultural health broker will do advocacy, make calls with this patient, draft letters, support letters, connect with different services to help them to navigate the system and maybe waive this bill, or maybe make a payment plan just to make it easy for them. The cross-cultural health broker also ensures the treatment adherence of the clients. So sometimes because of the cultural differences, some patients are not following what the doctor is saying. Sometimes because of the trust, they may not trust the healthcare system. So the cross-cultural health broker is actually the person who is coming from their country, from their own the background, from the same language, and the cultural broker is more trusted by people. So when they see a cross-cultural health broker helping them, they understand information better and they do better compliance with the treatment, and of course they have better health outcomes. The cultural brokers, when the healthcare providers are, and the same thing for the healthcare providers, if they are informed and if they know about the patient's beliefs and preferences, they will be able to fully understand the needs of the clients, as well as the barriers that may prevent them from following the treatment decisions. So from the provider's perspective, the broker provides cultural and language interpretation that assist them to more accurately diagnose and treat the patient. I actually have a slide here. This is one of our I'm not sure, Jonathan, if you changed it to this. Yeah. So here is our family physician who is working with cross-cultural health brokers at Umbrella, and that's what she's saying about how it is for her to work with a cultural broker. So she's saying that cross-cultural health broker are fundamental in providing culturally safe and equitable primary care to immigrants and refugees who experience language and cultural barriers accessing healthcare. They serve as a bridge between clinician and patients. Not only do they provide language interpretation during medical encounters, but they also add important cultural context to problem solving medical conditions, help patients navigate the healthcare system, and connect families with community support and resources. So she's saying that I have learned so much working alongside cross-cultural health brokers, and they have no doubt made me a better clinician for the patients we serve. And that's Dr. Janet Pedersen, a family physician at Umbrella. Before going to other slides and explaining about the differences of a cross-cultural health broker and interpreter, I would like to invite my coworker, Sochi, who she's also presenting today. So we would like to share some examples, some the experiences that we face with patients on daily basis. So as a discussion, we will share some examples. We will not be using patients' names, so you may have fake names for them, I believe. So we're going to share with you some experiences so you have a better picture of how a cultural broker is helping patients in healthcare.
Thank you, Wazhma. Well, I have, I think it's a good example. This person is, let's say her name is Maria, and she is a physician in her country, and she's having her appointments at Umbrella, and she is facing a lot of frustration for leaving her her country, her education, and she is having treatments for chronic pain. When she goes to the consultation room, I can feel that she is frustrated. She, in her mind, may have a way of treatment, and she has her own expectations. And at the same time, she cannot speak the language. So she's facing many barriers and frustrations. And when she is speaking, she tries to speak in English, and sometimes she is she's trying, but at the end she decides to speak in Spanish. And when she's telling me what to say to the teacher, the way that she says it is very straightforward. It seems almost like it's rude and is demanding. But I know her. I know that she's a kind person, and I know that what is happening to her in this moment is that she's scared, she's nervous, and she can't find better words. So I try to say what she needs to the doctor in a better way, and the doctor also understands what's happening to her and give instructions. I also try to give the instructions to her in a way that she will understand, because I understand that in her country, medicine works differently. So let's say we finish this appointment and she needs to go to the pharmacy, and in the pharmacy she is facing more obstacles because the same thing, she is not speaking the English. The medication she is taking or she needs is a very controlled medication, and the pharmacist cannot give it to her like in the way that she was expecting, like everything in once. And she doesn't know that she needs to call ahead to the pharmacy to ask for the medication, and probably like a couple of days before. And so in the way that when she goes to the pharmacy, she will have the medication ready for her. And so I realized that she was having that problem, and we decided that I will be calling instead of her. So that's what I'm doing. I call to the pharmacy and I let them know that I am supporting her because she does not speak the language, and that she, she has issues also getting to the pharmacy. So she cannot be continuing to go and get parts of the medication. I explained them that it would be better if she gets all the medication in once, and that we are trusting her. She's a trusted patient and she can handle the situation. So in that way, is going more smoothly for her. She is trusting more the system. She can go receive her medication in the pharmacy, and she doesn't have to explain, which was happening before, is that she tried to explain herself. The pharmacist got upset because they cannot understand. They may be thinking she is actually trying to get more medication than she was needing, etc. So I can see her with the time that she is now more relaxed when she is entering to the consultation room. She is trusting more the doctor, and she is not having so much difficulties getting her medication. And I think that's very important, very it might be just small impact, but for her is a lot. She is afraid of changes, and uh, she was really struggling.
Yeah. I think that I wouldn't say that it's a small impact. I think it's huge because, um, building trust with the healthcare system is very important. As you mentioned, that she feels more confident. She's taking her medications. She's following the instructions, and of course, as you said, she's more happy and she has better health outcomes, right? And this is actually um, uh, what we are looking for. When across cultural health brokers working with people, we were actually looking for people to get um, the healthcare that they need based on their individual needs, right? Because every patient is different. So that's actually a huge impact. And thank you so much for sharing that, Sochi. I'm going to go to the next slide explaining about the differences between an interpreter and a cultural broker. And we're going to come back to you, Sochi, for another experience if you want to share more. Okay, so what are actually the differences between an interpreter and a cultural broker? We often hear from patients that having cultural brokers very different from having an interpreter. When patients are going to hospitals or to different specialists, the interpreters are always changing. We have patients, the population that we serve, the patients are having past traumas. They have so many histories that are impacting their health, and they are explaining themselves to the healthcare providers. And imagine having different people at different appointments, like all the time when they're coming to the healthcare provider, they have different interpreters, and they have to go all over again and explain about their needs and explain about their, the stories that they don't want to go back and explain about. The cultural broker is a person who is with this patient working for a long time, knowing them very well, knowing about their challenges, their needs, their successes. Sometimes the cultural broker even reminding them about to mention things to the doctor that actually the broker um, remembers, but the patient, because of having all this mental health concerns and all this worries, anxiety about being new to a country and not knowing the system, they don't. Sometimes they don't even realize that they have some needs. So the cultural broker is the person which is a support for this person, and it's a bridge between the healthcare provider and the patient. I remember patients coming to our healthcare center. They would come with one need, and while I'm talking to them, while we're going to the doctor, they will tell me so many things. They will say that they are so much worried about their paycheck that's not coming for the next month to pay for their rent. Their children are having issues at school, or they want to apply for citizenship and they don't speak the language, and they want to become citizens. But the minute that we go inside the office for the consultation with the doctor, the doctor is asking them how are they doing, right? Very simple question. How are they doing? And they say, I'm good, I'm fine. But I'm reminding them, you were just telling me some stories, like lots of things that are actually concerning you at the moment. So would you, like, you want to share about those needs, and you want to talk about it to the doctor? So imagine not having this kind of person, like not having a cultural broker. Sometimes our patients are shy of talking about their needs. Sometimes they don't remember it. Sometimes they don't know how to, like, in which order talk about them, because they have so many needs. So a cultural broker is very important to be involved in these kind of communications with the healthcare providers. That really improves their access to healthcare. Okay, and then as it's mentioned here, the interpreter is only providing, word-to-word interpretation. They don't do advocacy for patients, right? As a cultural broker would do. The cultural broker is at the same time provides relevant cultural information, facilitates language and cultural barriers between patients and healthcare provider. A cultural broker actually helps patients access services and resources. The cultural broker always tries to connect people to different services, and they do advocacy for patients and within healthcare and other services. So before going to the next slide, Sochi, it would be great if you want to share another experience of yours.
Yeah, I have several, and it's been difficult to pick just a few. But
Right.
talking about a cross-cultural health broker navigating the system with the patients, in not just the healthcare but other services, it came to my mind this family that they the child went to the pediatrician at Umbrella, and it was necessary an assessment for autism. And so what we do as CCHPs in this case is finding foundings for the family, because this assessment is very expensive, and uh, they cannot afford, in this case this family couldn't afford the assessment. They have a very low income, and so we are applying for this funding for the assessment, and it came up another situation that is needed the notice of assessment. So we tried together to do it through like online, but it was not possible. We faced some issues and we needed to call to the CRA. So in this case, I talked to, it was the father who needed to talk to the CRA, and I spent some time with him before explaining him and preparing him for that phone call. I was telling him, because they don't speak English, it's just very limited. I said, you need to practice to say your phone number in English, because they will ask you. If I say it, they may hang up on us. So, and you know, waiting for them to answer it, it can be more than an hour sometimes. So I said, we don't want that to happen. So they need to listen to you. So please practice your phone number. They will ask you, and I say it in English, what is your name? And you may say it in that moment. Also, they will ask you maybe your age, your address. You need to practice to say your address in English. And everything else, that's just the main part when they want to speak directly with the client. I said to them, everything else I can support with, but this is a very important part. And so we are calling to us the CRA. The patient, the father, he's not the patient, sorry. The father is going to work, and he's in a ferry, so it's very loud in his side. And the agent from the CRA answers, and she is very understanding. I explained her the situation, and I explained that he has no other option because he's going to work, and that's the moment that he can actually speak to her. And that we are sorry that is noisy, but that's the way it is in this moment. And she understands, and so she does ask the questions that we were expecting, and he is ready. And sometime on the phone call, he cannot hear, or for her it's also difficult to hear what he's saying because it's really loud. Sometimes it's the microphone going very loud, or people around him. And but I was glad in this situation that the CRA staff was very understanding. And at the end, we found a way to find a solution for him to get the notice of assessment directed to his house by mail. We took a long time though, because it was a lot of repetition. He didn't understand the process. So we went back again to the beginning 2 or 3 times, but we made it, and we got the notice of assessment, and from there we can continue with the founding. So this person, after the phone call, he contacted me, and he was very sorry, and he was saying like he was embarrassed for his English. And I said, don't worry about it. You know, I'm an immigrant too, so I went through that too. So I'm here for supporting, and you know, is building that trust that he can just try it and it's okay. And I made him understand that I lived that situation also. So
Right.
yeah.
Yeah. I mean, communications with Canada Revenue Agency and IRCC, it's very complicated because they always ask for security questions, and immigrants and refugees when they're new to Canada. It's hard to have answers to all those questions. Sometimes it's complicated, and sometimes if you don't know the system, then you don't know how to reply to that. And I really like it that you give this sense of confidence to him that he is okay, he was doing well, and you give yourself as an example that I'm also an immigrant and I also had these issues before, right? So that makes him to feel that he is not the only one, and at the same time he feels this confident, okay, actually I was doing well, so I can do it next time. And I think that's very important. Thank you so much for sharing that. I'm aware of the time. It's 9:40 for Pacific time. I know the times are different. So we have 20 more minutes, and I know that we have to give time for questions and answers. So I'm going to the last slide, Jonathan. I'm going to just quickly talk about the cultural brokering in healthcare, although we were mentioning that throughout the presentation, but I will just go deeply into that, maybe for 5 more minutes, and also explain about the challenges that people face by accessing healthcare. So cultural broker in healthcare, cultural brokers facilitate communication, as we also already mentioned. They improve understanding and help patients navigate the healthcare system in a way that's respectful of their cultural beliefs, practices, and values. And those challenges, we as immigrants, all of us, we face that the challenges of accessing healthcare or understanding healthcare or communicating with healthcare providers. So of course, that's language barrier. It's huge. So the challenge is that many immigrants and refugees, they don't speak the language when they're new to Canada, and it makes it difficult to communicate with healthcare providers and understand medical instructions and articulate their symptoms and concerns to the healthcare provider. So a cultural broker in this situation, how they can help. So they will, of course, translate medical terminology to the patient. They will explain instructions that the doctor is giving, and they will ensure that the patient needs are accurately, conveyed from the patient to the doctor. So additionally, cultural brokers may assist in understanding some nuances of medical discussions that, because medical practices are different in different countries, and patients are used to one kind of medical practice and healthcare, but the cultural broker can explain that to the doctor, so they keep that in mind when communicating with the patient. The cultural differences, of course, people are coming from diverse groups, different countries. There are communities that prefer, for example, herbal remedies, but in Western countries, it's more medical or medicine-based, right? As cultural brokers, we need to explain to the doctor their beliefs. And at the same time, the other challenges can be distrust. We already talked about this, that patient may not trust the Canadian healthcare system. And that's because, sometimes the appointments are you have to wait for a very long time to see a specialist. And that brings frustration in patients. So many immigrants and refugees, and those who are coming from war-torn countries, they have experienced trauma, as we already mentioned, that they have some mental health concerns, and they may not be able to communicate their needs to the healthcare provider. They may have limited knowledge about healthcare system in Canada, so that makes it difficult for them to navigate the system. The other barriers can be accessing services. For example, immigrants and refugees are facing challenges as a limited access to transportation, lack of childcare, for example, issues with working multiple jobs that makes it difficult for them to attend medical appointments. The cultural broker can help address these barriers by providing information about community resources such as transportation services or applying for different benefits and giving information about free clinics to patients, and to make it easier for them to access healthcare. Some people are having fear of legal consequences of, deportation, for example. some people are undocumented and they have this fear of going to healthcare. I know patients who had emergency situations, medical emergencies, and they were not going to the hospital because they were scared of being deported. So the cultural brokers are actually there to reassure patients that the hospitals are providing healthcare to anyone who comes in, and they can't, they don't actually deny service. They may later on receive a large bill, but they will receive service if they have a medical emergency. Some patients don't have health literacy or literacy in general in their own languages because of the the challenges being in different countries or being in a refugee camp. They may have not have opportunities going to school or have a literacy in their own language. So that makes it even more complicated to understand Canadian healthcare system. There may be economic barriers. For example, immigrants and refugees are facing financial hardship because of lack of employment, and that's of course very stressful for them. And cultural brokers can connect patients with financial assistance programs, income assistance. They can help them to find employment, and of course many immigrants and refugees may face discrimination, and cultural brokers are there to advocate for patients in this kind of situations. There are so many barriers that I can talk about for very long, but I know there's little time that we have for questions and answers. So Jonathan, back to you.
Yes, thank you so much. Thank you, Wazhma and Xochitl. That was excellent, very, very informative. Yeah, so we'd like to kind of open it up, for questions now. You can either type your questions in the chat, or you can raise your hand, and I can, unmute you, and you can ask that way. I know we did have one question, but I believe Farzad answered it in the chat, but it was asking if Umbrella is independent from the local healthcare system, for example, Fraser Health in BC. And then Farzad said, yes, our Umbrella is a nonprofit organization / community health center. So
yeah, thank you, Farzad, for to replying to that. Just to mention, we are a nonprofit organization, but we are funded by Ministry of Health, and Fraser Health is actually their involvement with the with us is that they are helping us to communicate with the ministry. So they don't have. There's no authority, but there's kind of facilitating the communication between us and the Ministry of Health. Yeah.
If anybody else has anything. We did have a question about how long, generally CCHBs would work with a patient. Is it usually, I know it obviously would differ depending on the patient, but is it, how often is it kind of a one-time thing as opposed to, an ongoing?
That's a very good question. So for Umbrella Health Co-op, any patient is a patient for lifetime. So anyone who comes to Umbrella and we are attaching them as a patient, they stay with us until they want to, move, or if they're moving somewhere, they can move. But they're our patients for lifetime, and they will always have cultural brokers support when they're seeing the doctor or the counselor or the social determinants of health program. So anything within the clinic, they will have the cultural brokers support. Sometimes we support patients outside of our clinic as well. So we can, for example, if there's no interpreter with a specialist, then our cultural brokers will make that time to, be over the phone with the patient. Sometimes we do exceptions. For example, there is an autism assessment and there's no one to support the family. So we try to go there with them and be there to provide language support for that assessment. And if we see that it's really important for the family and it's really impacting their health, we make exceptions, and we provide them with this support of cultural broker even outside of our health center.
Right. We also had a question in the chat asking, it was Hong Ying Wang asking, do you accept new patients?
Yeah, so I mean, we try to, our our model is unique in BC. There are some community health centers that are recently opened and they have cultural brokers, but Umbrella is kind of the first community health center who was practicing cultural brokerage. So that's why we have a lot of referrals, and we have a long wait time, and we have limited numbers to serve. And I think it's always like that when the provincial government sees the need and sees that it's actually working. Of course, they will give more opportunity to Umbrella to accept more patients. But at the time, we have wait list.
Right. So sorry, did you have your hand up?
Yeah, I just wanted to add about the services as a CCHB. Also, we have contact with the patients in between consultations. We support them with, for example, if we know that the patient is going to have a consultation in a week, we are reminding them to go to do the labs before that appointment. Sometimes they just forget, or they don't make the connection that maybe in that appointment is necessary to have the results. And other things is also reminding them of appointments in other services. It's not that they forget, is that their situation is very complicated, that sometimes it's just something outside, or more like sometimes they are overwhelmed by many situations combined, and they need this extra support. So we can sometimes identify if they may need another like rescheduling that appointment, or if they need something else for going to that appointment. So basically it's reminders. Sometimes the doctors ask us, can you support this patient to find an orthopedic clinic? So we search around their area where they live, and we kind of try to find the closest to them. Sometimes we even try to find who speaks Spanish in that clinic, stuff like that. So it's a lot of communication outside the consultation room as well.
Oh, that's great. We also had a question, and this was touched on a little bit in the presentation, but from Carolyn in the chat, was asking, do cultural brokers act this, as interpreters, or are they different? Do they do the same work or not? That was touched on a bit.
Yeah, we talked about this, but so I would say a cultural broker is providing a holistic care. It's not only about language support or providing interpretation, but a lot of other things that Xochitl just mentioned about connecting, referring patients to different services, doing communications, like supporting the communication between the other service providers and with the patient. Even, helping patients with navigating the legal system, the immigration system, talking to different government, non-government organizations. So it's a very wraparound support.
Right.
Yeah.
That's great. And then one other question that we had was, for example, like if someone, is taking, medication, like how do you ensure that they're that they're doing that, or something like that. If it's something that you kind of have to follow up on, is it just, are you following up kind of with the patient? Yeah.
Yeah,
I can answer. I can
yeah,
answer that.
Sochi, please go ahead.
We have kind of a internal communication about that in the clinic, and just let's say this patient is asking for a refill in his medication, and she cannot explain what is the medication, and if it's really out, like is she's not having more refills, or if we have to ask a prescription to the doctor. So what sometimes we do is we tell them, can you take a picture of the bottles, and so we can actually see what the medication is, how long they are taking it, and it's always in the chart. But sometimes we don't know how many pills she's still having, and so we can see everything from a picture. So we have all also our ways we get creative.
That's great. Yeah, if there's any other, we have about 5 minutes left, so we probably have time for 1 or 2 more questions if anybody has anything. If not, we can kind of just wrap it up a little early, but yeah, if anyone has anything, you write in the chat, or you can raise your hand and I can unmute you.
Yeah,
Oh yes, Tracy. Here,
Hi, Tracy.
Here, I'll unmute. Allow mic. There we go. Sorry, I think you're still muted, Tracy, but you can unmute yourself now.
Hi, Wazhma. It was an absolutely fantastic presentation. I'm sorry I wasn't able to be here for all of it. I got called away. But I was just wondering, I don't know if you touched on this, but how your team deals with maintaining boundaries with their community, and how you deal with that, and if there's any emerging or promising practices you could share, or are you the same as all the rest of us, and it's really a challenging situation. Thank you again.
Yeah, thank you, Tracy. It is very hard to maintain the boundaries with the community members that we are helping, or the patients. It's challenging because they have high expectations. High expectations because we are coming from the same countries, from the same language, and when they see cultural brokers, they think that they can ask for anything, and they think that we have power on everything. We can change things for them, and government system, or maybe we can increase their benefits, or maybe just find them a housing like really quickly because we have this power. But we have to explain that to them, that we are just the support system for them, and it's all up to the other services, how they provide their service. For example, we can apply for BC housing, but we can't guarantee that they will get it. We can apply for income assistance, but we cannot guarantee that they will give the amount that they're looking for. And at the same time, there are challenges in communication and keeping these boundaries of not being contacted by a patient like 24/7. They really because they're trusting cultural brokers, and because they know that they are there to support them. Sometimes they are, it's overwhelming. They can call you like 11 p.m. And ask for some questions or ask for support. But at the same time, we try to debrief within our team, talk about this, and find the ways to explain to the community members, that explain about our role and how we have our own, organizational rules that we have to follow, and we can't be in communication with them for 24 hours. So it is challenging, but we are trying our ways to, train and support our staff to communicate with patients.
Thank you.
Yeah.
Yeah, so sorry, I just see some few people typing in the chat, so I just want to make sure I don't miss any questions.
Yeah,
But
if we can't answer them now, you can send that to me by email, and I can reply to those questions for sure.
yeah, oh, that's great. Yeah, just thank you so much, everyone, for making the time to join us, and the fantastic questions. And thank you so much again to Wazhma and Xochitl for taking the time to join us.
Thank you.
If you want to learn more about CBNC, or if you're interested in becoming a member, the website details are available again in the chat. I will put it in there. It's culturalbrokers.ca. I spelled it wrong. Culturalbrokers.ca. So yeah, you can learn more about us there. You can follow us on social media and stay updated what we're doing, to help support cultural brokers across the country. This recording, I believe, will be made available on our website likely tomorrow or next week. But yeah, just thank you so much, and I hope to see you all at one of our upcoming webinars or events. I believe our next webinar will be in a couple of weeks. There'll be information coming out about that very shortly. But yes, thank you again so much, Wazhma and Xochitl, and thank you all to everyone for joining. And yeah, we'll see you all soon.
Thank you so much.
Thank you
for the opportunity.
Bye, everyone.
Bye. Take care.